What is maternal mortality?
So maternal mortality can be defined in a number of ways. I think what we think of most commonly is a maternal death or the death of a pregnant or recently postpartum woman. Typically, postpartum is up to about 6 weeks after a delivery. There are a number of different definitions that might include longer periods of time. Some of the definitions include causes of maternal deaths that are incidental or accidental, not necessarily directly related to the pregnancy. But I think when we generally think of maternal mortality, we think of pregnancy-associated deaths of a pregnant or postpartum woman.
And what are examples of, say, the top 3 causes for maternal mortality? What's causing the loss of life for these women?
So there are a number of different causes for maternal deaths, for the unfortunate event of a maternal death. And the causes vary by region, where you are in the world, also where you are in the United States. But in general, the most common causes of death include causes related to cardiovascular or heart conditions. A cause of death during pregnancy or during a delivery can typically be associated with excessive bleeding at the time of a vaginal delivery or a C-section. And then other causes include infectious causes. So if you have an infection after a surgery, and I would say to round out the list, there's also causes of death from high blood pressure.
Okay, so someone with the condition of hypertension, if it being undiagnosed and she's pregnant, that can lead to her having a poor outcome during delivery, but also after?
Exactly. Actually, a lot of the deaths and morbidity that come from high blood pressure disorders of pregnancy do occur in the postpartum period. So it can occur at any time in pregnancy, both during and immediately after.
Okay. So what is the rate of maternal mortality in the United States?
So the rate varies year by year. Most recently, the rate was about 20 per 100,000 births, which basically means that for every 100,000 births that happen in the United States, 20 women die from pregnancy-related causes. Wow. In that year.
And so why is this rate increasing in the U.S.?
There are a number of factors that people are positing or postulating as to why the number is increasing. And there's no one surefire explanation. I think that a couple of different reasons. One is that we are potentially taking care of a sicker population of patients, not only just from a health perspective, but also there are a lot of women that are having pregnancies at later ages than was done in the past. So that's one potential cause. The other causes include increased ascertainment. So there's been a big push.
What does that mean?
There's been a big push to get better at trying to figure out when these actually happen. So we weren't always well equipped to keep track of maternal deaths. And there was possibility that deaths were occurring and they weren't being tracked or noted. So there's been a big push to not only keep track, but also review maternal deaths. So some think that that has also, the ascertainment that I just mentioned, just keeping a better track may have also led to what we perceive as an increase in rates. I think irrespective of what's going on, I think a maternal death is a very serious consequence. And whether the numbers are changing for X, Y, or Z reasons, I think that the facts need to be reckoned with and we need to figure out how to make some changes.
So it's almost similar to how ADHD or autism seems to be diagnosed more, but compared to, say, 40 years ago, we didn't really have the guidelines or the appropriate tests to pick up or know how to screen. And now we're better at data collection in the internet age. And then we have data being pulled from several hospitals all going into one collective database that probably wasn't present in the 80s.
Exactly.
Okay.
I think it's important to also, not just look at the overall rates, but also the absolute numbers. So I think it's important for women to know that in the United States, taking the year 2020, for example, roughly 850 women in total died as a result of pregnancy-related causes. And that's out of about 3.5 million births. And I think it's important to make that comparison to other nations globally. For example, sub-Saharan Africa, there was around 200,000 deaths. That's the average annual number in absolute terms in comparison to the 860 I mentioned for the United States. And the number one cause of deaths in that region is excessive bleeding at the time of delivery, which most people consider to be something that can be prevented or corrected. So with blood transfusions or medicines that help women not bleed as much during a delivery. So I think that discrepancy just really hits home the importance of resources and the fact that a lot of these deaths are potentially preventable if the right resources are in place.